Hi everyone, I am Dr. Terry Whittick with Next Level Health and Fitness. Today I'm going to be talking to you about shoulder impingement, the anatomy behind it, why it happens, how it occurs, kind of shed some light on the injury for you. So with that being said, I'm going to start with the anatomy. I have a little model here to show you. So this is the right shoulder. All right, so this is, if I took all of this off, this is what you'd kind of be seeing underneath. So we all kind of know we have the rotator cuff muscles. So in the front here, you have the subscapularis muscle. And then underneath, you can kind of see teres minor. And then if you turn this around, you have the supraspinatus and the infraspinatus. So those four muscles kind of come here and they form a capsule around, this is the top of the arm bone, the humerus, so right here, okay? And then you have your clavicle, which is what runs across to the neck, and then what people know as the shoulder blade in the back, all right? And then this is the biceps, top of the biceps tendon here, so kind of running down where the biceps. So with that being said, what happens is, if you look here, there's a little space there. So this is the subacromial space here. So this is the acromion, which is the bone. Underneath here, you have a little bit of space and you have like a fluid-filled bursa that's usually there. So what that does, it cuts down on friction in that area, like when you're lifting overhead and stuff. So what happens with impingement is that little area starts to get less and less and less and less. So as you lift your arm up overhead, it starts to pinch there, all right? So the supraspinatus, so if you look at the back of the shoulder, so this rotator cuff muscle runs through here, underneath, through that little space, and attaches here. So this is the most likely torn rotator cuff muscle. Usually you don't tear any other ones without tearing this one as well. In rare occasions it does happen, but usually that is the one that's torn. So you can see that if that space is smaller and it's rubbing on that area, how that could be not so great for the shoulder, okay? So that happens when you do a lot of overhead reaching, you know, people who paint a room one weekend, so they're doing a lot of overhead stuff that they're not used to. People that sleep with their arms up over their head on their stomach, you know, kind of up here or behind their head. Prolonged doing that, you know, 7-8 hours a night for years at a time is going to wear away at those muscles. So that's where people get rotator cuff muscles or tears without injury, okay? So that is impingement. So that's when that space is inflamed, that bursa that you don't see here on this model, but the bursa is inflamed. You start to form bone spurs. This is where you start to form those bone spurs that people talk about. And those bone spurs are like a dull knife and basically cutting away that rotator cuff. Okay? So I want to talk a little bit about how posture plays a huge role in impingement syndrome. And people don't always realize that. So we talked about sleeping with the arm up over your head is not good. Please don't do that. Another thing is that people don't realize is that we're all very forward in our lives, meaning that we're on the computer, we're on our phones, we're doing everything ahead of us. So what happens is the top of this bone, the humerus, starts to kind of shift forward. When it shifts forward, it changes the mechanics in that area, putting the rotator cuffs more at risk for being torn. And it doesn't help the area. So just an example, if you have enough room, I want you to stand up. I won't stand up because I will be out of the camera here if I do. And I want you to kind of get poor posture, leaning forward, and I want you to try to raise your arms up over your head. Okay, so you notice that it's super difficult to do, but if you bring your shoulders back and you try to raise your arms up over, that it's much easier because it's placing the joint at a better mechanical position. You know, here, the shoulders forward, that's why you see those elderly people that are, you know, they can't reach up to get the can of soup off the shelf because of that posture. And I hate to say it, but the longer you're like this, you're not going to reverse bone structure changes in the spine. So when people come to therapy and they have what's called forward head, which means that the head is actually placed forward where it shouldn't be, most likely we're not going to correct this substantially. We're going to further prevent it from getting worse, okay? But those angles change everything. And if we do try to correct that, it's going to actually throw the person's balance off because it changes it. Everything changes to try to make up for what you're lacking in the neck and in the shoulders. So posture is super important, not only for neck pain, but for shoulders too. All right. So I want everybody to kind of take a look at what their computer or their job every day, you know, are you doing a lot of overhead stuff? Are you at the computer a lot? Are you reading or on your cell phone? Try to kind of take a minute and think about what you're doing and think about how that may play into shoulder pain. So with that, when somebody comes in for impingement syndrome, I'm not only treating the shoulder, but I'm also treating posture. Actually, that's probably at least 50% of it, because most of the time patients have postural deficits with their shoulder problem. So things like using the foam roller, strengthening the muscles in the back, stretching the muscles in the front. Foam roller is a huge one that I do postural stuff with. If you like what you see in this video, please like it. Next video is going to be covering some postural sequence on the foam roller. So if you have one of those at home, great. If you don't, it's okay. If you like what you see there, you can always go out and purchase one. They're relatively cheap on Amazon. And it's a great thing to not only have for the legs, but also for postural stuff. So I hope that you enjoyed this video, and please check out my website. It is www.nlhealth.net. Thank you.